recording anymore. Thanks, Jack Hole, for interrupting. The patient can present with signs of dehydration from vomiting and frequent hot baths and showers. If not treated, cannabinoid hyperemesis syndrome can lead to acute renal failure. Other common sources of drug and overdose are prescribed and over-the-counter medicine. Accidental overdose typically occurs when the patient does not understand the prescription instructions and takes too much of the drug, or the patient is forgetful and mistakenly takes the drug more often than they need. Patients who are on many different medicines might have synergistic drug interactions when adding a new or over-the-counter medicine. That's why it's very important when you pick somebody up to take their medicine with them, not only the prescription medicine, but any kind of vitamins that they take, any kind of over-the-counter things that they take, okay? You'll go in some people's houses and they got a whole suitcase full of freaking vitamins from wherever. All right, take that with you. Many chemicals used for huffing accumulate in the regions of the brain responsible for the feelings of pleasure and reward. After time, they migrate to other regions where they can cause abnormal muscle conditions, coordination, and alterations in mental status. Oh, hold on, we missed that. R. Huffer, bless his heart. Keep in mind that inhaled poisons typically have a more immediate onset of effect than injected poisons and can produce more systemic effects. Remember also that inhaled poisons can destroy lung tissue, leading to severe respiratory compromise and significant respiratory distress. Treatment is geared towards removing the patient from the exposure, assessing and treating any loss of vital function caused by the drug, such as airway, breathing, oxygenation, or circulation deficits, and providing rapid transport to the emergency department. What is another thing that they commonly huff? Anybody know?
Aerosol, the computer cleaner.
Yes. What about carburetor cleaner?
Oh, yeah. Oh, that stuff smells so good. Star plug.
Alright. The patient, Vince, is 37. Known to law enforcement as being homeless and having a history of schizophrenia. Vince is a disoriented person, place, and time. Tomas takes a set of vital signs while Bob listens to the breath sounds. Bob hears scattered wheezing throughout both lungs. Heart rate's 92 with an occasional irregular beat. Blood pressure is pretty good. It's 118/78. It's probably better than mine. Respirations are 24 and the SpO2 is 95%. So, besides the altered level of consciousness, I mean, he's pretty okay, huh?
Yeah, you got a little irregular heartbeat.
Yeah, well, you know, you can't have everything.
Respirations are fast. Slightly.
Yeah, I'm not real worried about that.
Tachypnea.
Tachypnea.
Uh-huh. At least it's not radicnia.
Despite the SpO2, the history of inhalation and the wheezing make Tomas and Bob concerned about oxygenation, so they administer 4 liters of oxygen, nasal cannula, and frequently reassess lung sounds and SpO2. Stop doing that. Don't you know that's, like, contagious?
Mm-hmm.
After evaluation and treatment in the emergency department, Vince is admitted to the psychiatric unit for treatment of his schizophrenia and drug abuse. Bless him. Bless me. Alright. Anybody got any questions about drugs, alcohol that I may be able to answer off the record?